Okay, because I realize we have Cassidy here who doesn't know everybody, I am going to run around and just make quick introductions. And really what I'm really interested in is, you have something that you want this group to know. Give us an update, quick, short, and I'll start with Lori Tinker.
Hi, I'm identified as Puget Sound Fleet, which I've never understood and don't understand how I got that tag, but that's me. Right now, I'm the president or chair of the EMS Council and representative of Jefferson Healthcare there.
Thank you. Matt.
Matt Reddy, one of the Jefferson Healthcare Hospital Commissioners. Good to see everyone.
Good to have you here. Jim.
Jim Novelli, Executive Director, Discovery Behavioral Healthcare, and really don't have anything new, but it's what, 17 days to Christmas. Get your shopping done.
Yeah.
Dr. Carlbaum.
David Carlbaum, EMS Medical Director, i.e. supervise the care of people before they get to the hospital. My only big update is, when I review runs for quality and give feedback, both positive and opportunities to firefighters, and very few opioid overdoses this past month. And I can't even begin to wonder if there's some association with almost 300 naloxone kits being passed out by somebody.
Well done. Lisa.
Me, Lisa?
Yes, you, Lisa.
Okay. Hi, everybody. Lisa Ray Thomas. I'm with the UW Addictions, Drug and Alcohol Institute and also the American Indian Health Commission of Washington State. And we just wrapped up our 5-part series, Tribal Sovereignty in the Indian Healthcare System, which is all recorded. So I will put that link in the chat.
Great. Thank you. Commissioner Brotherton.
Hello, Greg Brotherton, Jefferson County Commissioner. And I'll share quickly, I guess, that down at Coswell Brown Village, the outdoor shelter on Mill Road, Community Build brought over the first 10 tiny shelters there, and they were met with tears of joy for people moving from a tent into one of those tiny shelters. So really great day. So good to see everyone.
Progress. Thank you, Greg. Sheriff Noel.
Good afternoon, everyone. Joe Noel, Jefferson County Sheriff, working from home today. I know others of you have probably done this, but I've had a 2-day meeting that's nationwide that's been going it starts at 6:30 in the morning and goes till 3 for 2 days. So it's finally over, and I'm glad to be here and see everybody, and to see Lori, that you're still alive.
I'm still alive. Anya.
Hi, I'm Anya. I'm a social worker and I'm a contractor with the Behavioral Health Consortium, and I've been one of the driving forces behind distributing those 300 naloxone boxes. So I'm excited to talk more about some plans for the next end of this grant coming up in a few minutes. So I'll pass it on for now.
Thank you. Chief McCurd.
There we go. I had to get my mute off. Tim McKern, Cool Scene Fire Rescue in the South End, and I work for Lori and Dr. Carlbaum. So I am pleased to say that our call volume for November was up EMS wise, and you're right, we didn't have any overdoses. That was great news. I think the weather contributed to a lot. I know we're tired of the snow, and the folks are tired of driving in it and making sure everything else happens. I too am just like the sheriff. I'm actually working from home. My wife had minor surgery, so I'm playing nursemaid for a couple of days. It actually gave me a chance to even though I'm home, I've had Zoom meetings all afternoon, kind of like the sheriff is. So I've been tied up with meetings. So glad to be here.
It's funny how productive we can be even while we're sick now.
Yeah, exactly.
Dunya.
Hi, everyone. Dunya Fo, Jefferson Healthcare. Happy to be here.
Cassidy.
Hi, everyone. I'm Cassidy. I'm also with Jefferson Healthcare. I'm their population health coordinator there.
And Cassidy, we'll take you through these introductions a few more times, then you'll have down who everybody is. Apple.
Hi, everybody. I'm Apple Martin, Director at Jefferson County Public Health. We're working on some sort of elaborations to our harm reduction services here at the health department. And we're sharing some of those evolutions of our services with our local board of health. And we're sort of growing internally as an agency to try to better serve some services that really have needed some lift for some time. So we're excited about that. And it's, you know, it's in process. I think that's happening in parallel also with some new work that we're doing around climate change and health. And for the purposes of this meeting, it's really important to think about sort of the upstream concepts around where climate change and health intersect and what we are doing to prepare and the outcomes that we're going to see with regard to people's behavioral health profiles. Already very complicated, but the impact of climate change on that is further yet to be seen. And there's a lot of work ahead for us to do to try to help support our communities around substance use and mental health with regard to the change in our environment. And with that, I'll pass it on to the next person.
Thank you, Apple. Jolene.
Good afternoon, Jolene Crone, Deputy Administrator, Clinical Director with the St. Louis Behavioral Health Administrative Services Organization.
Thanks for being here, Jolene. Chief Olson.
Tom Olson, Chief of Police, Port Townsend.
Good to have you here. Brian Richardson.
Hey everyone, Brian with Dove House Recovery Cafe. I was grateful to participate in the UW research project through the Empowered Teens Coalition last Friday. It was great to just be in the same room again after COVID had made it that we just didn't do that. So that was cool. And also an opportunity for a lot of our members here at Recovery Cafe to show up and provide their perspective of folks who have lived experience with these things. A couple other things I want to say is we've heard from our members too, a lot of great things about Castle Brown Village. A couple of our members have gotten into either the tiny homes or have gotten their rig hooked up, you know, electricity and all that. Super happy about that. And then the last thing is that Dove House has purchased the residence next door to Recovery Cafe here. Get the keys in a couple weeks, and we're turning it into low-income transitional housing. There'll be at least 3 units, and one of the units as large as being able to house a family of 5. So excited about that. Some of it may take time, but the studio, I think, is ready to house someone like right away.
That's exciting. Thanks, Brian. Adam.
Hi, Adam York, work at Jefferson Healthcare with Dunia and Cassidy.
Have you here? Gabby.
Gabby Caudell, I'm the Clinical Director of Believe in Recovery and the RSAP program in the jail. I have a lot of exciting updates, and I'm sure we're going to talk about them shortly. I am also working from home in South Carolina, so.
Denise. Oh, sorry. Thanks, Gabby. Denise.
Hi, Denise Banker, the Community Health Division Director at Jefferson County Public Health. And we're just working on all of the viruses that are going around Jefferson County right now. And so no real updates besides that. There's RSV and the flu and of course COVID. And we will be getting in a bivalent booster for kids under 5 here pretty soon. That's just come out from DOH, and still working on expanding our harm reduction activities here. So thanks.
That's exciting. Okay, did I miss anybody? Again, I think I didn't. The one person who I was hoping was going to be here is Chief Black, because he's got a piece of our program. But let's start out with just looking at the agenda really quickly and giving ourselves a sense of what we're going to be doing. Just share my screen quickly. Okay, are you guys seeing something that says Zoom?
No, briefly we saw it, the agenda.
Briefly, you did see the agenda. Okay.
Yeah.
Okay. There we go. Thank you.
Yep, it's the agenda.
Okay, today we are going to do some work around getting funding dollars, developing your awareness of what we're considering for funding dollars The process on that will be to have, we have 2 requests in. One is the harm and stigma reduction effort, additional engagement and education that Anya will be talking to us about. And the second is the East Jefferson Fire and Rescue CARES program. The way we're going to handle it is I'm going to have each group or each funding request do their presentation. If you think of questions or feedback or whatever, I'd like you to click that link, and I've put the link to the slides in the chat so that you can get to that link. And then put your questions for any of the presentations that you see today in here. And then we'll come back after you've seen both presentations and go through a conversation around the points that people have brought up. Is that clear to everybody? Looking for nods. Thank you. Okay, let me get back to the slide. And Anya, I'm going to put you up first.
Sounds good. Thank you. So yeah, I'm just gonna read through some of my plans for now and through August. So with the goal of getting that harm reduction vending machine installed and set up down at the Brennan Community Center, one of my central focuses for the next part of the grant is to do community outreach and build community desire and education and understanding and support around harm reduction strategies and why Brennan is such an opportune place. Additionally, expanding access to overdose prevention education, reducing stigma related to substance use, increasing naloxone access and training, and growing understanding of related community needs in South County. So planning more specific outreach and workshops and trainings in Brennan and Quilcene, as well as more community trainings and education events beyond those ones already scheduled. So looking at collaborating with potentially the library or Chamber of Commerce. Definitely, if you have other ideas of other places in the community that would be opportune to build a relationship with, please put that in the notepad that Lori's sharing. But thinking of spaces like the library and like Chamber of Commerce, and also maybe the cannabis stores, or doing specific outreach with some of the bars and more of the night venues in Jefferson County, as well as collaborating with Jefferson County Public Health, potentially Ocean, who many of us have met, who's one of the awesome syringe exchange nurses at JCPH, to execute a Zoom trainings. So inviting the public into a scheduled Zoom time where we can do an naloxone training, maybe have some trainings around stigma and language, and how to show up for people who might be active in their use or in recovery, and developing some videos that we could host on the BHC website and or Jefferson County Public Health YouTube and social media, with some of these trainings so that they're more accessible to the public about how to use Narcan, and how to, what resources are available in our community, and learning about reducing stigma and showing up for folks. As well as following in the footsteps of what Gabby with Believe in Recovery and Ocean with Jefferson County Public Health have been doing, is more direct outreach to folks who are unhoused or insecurely housed. A lot of my outreach since I've been doing this since April has been more to the general public at public events, which has been great and is definitely meeting some of the grant requirements and some of our community goals, but realizing that the most vulnerable people in our community also deserve and need access to some of these resources. So doing some more direct outreach of naloxone distribution, as well as other harm reduction tools. Maybe that's warm socks or some hot hands, hand warmers, food and things like that. And all of these activities address the various points. This is really small for me to read, so I'm not going to read it to you, in the grant core activities. But yeah, please, if you have any questions, ideas, or would like to invite me to partner with your organization, please populate that in the Wordle, and always feel free to reach out to me directly on my phone or email. I think that's all I have.
Thank you. So this 25,000 that we are talking about allocating to the work that Anya's just described would be in addition to the funding that we've already given, which I think is 23,500. I think I have that right, that we've given to date toward that work. But I think it's been a good investment. And for the folks who are signed onto the MOU for this consortium, those are the folks who will actually vote on this. I'll be reaching back to you after the meeting to get your vote on whether you're endorsing spending the money this way or otherwise. Now, our next funding request is from East Jefferson Fire and Rescue, and I thought Chief Black was going to be here. He'd given me some slides. I'm going to give you a quick overview, and then maybe if he isn't here, I'll ask Gabby to step in and tell a little bit about the CARES program. Again, there's a link right here. If you have questions, go ahead and put those into the Padlet, and we'll come back and have a discussion after this first presentation. So this funding request is for $46,000. That would cover 2 months of the CARES program. You can see that the CARES program addresses several of the core activities on the grant, and I'm sure Gabby will give us a more detailed description of who will be doing what with the program. I also wanted to outline with this particular opportunity is that we'd be braiding funding between funds that East Jefferson Fire and Rescue got through a grant that's hosted by the city, an All Washington City grant, which was for $217,300. That should fund it for starting up and carry the program through June of 2023. And then there's been another from the BHC 0.1% money yesterday, allocated $50,000 each year for 23 and 24 toward the same CARES program. I apologize. Somebody's saying that it's not in presentation mode and it's hard to read the slide. So let's see if we can rectify that. Hold on. My screen hates presentation mode, apparently.
You might have to put it in presentation mode and then share it.
Yeah,
Sometimes,
let me
you
try
know,
that.
exactly causes
Let me
a
see.
hit.
My apologies, folks. Thanks for your patience.
No problem. And Anya, I'm going to use this time to steal a little bit of the air and say, when you set up a Zoom education with Ocean, if you think it's appropriate for me to be there, I'd love to be there to, if people had specific medical questions, if it worked out. Zoom works really easy for me. If you think it's a barrier to have a white cisgendered man there who's a physician, then tell me, like, come some other time. Open
Off
to
the top
whatever
of
you.
my head, I don't think it's a barrier, and I think it would be great, especially for like presentations to the general public. So thanks so much. You were someone who I was thinking of, and if anybody else is interested in being a part of that education, please feel free to reach out to me.
Awesome. I can also ask the fire chiefs if any of the paramedics or EMTs would like to participate, because I think it'd be great to have some of them there too.
Absolutely. People with that firsthand experience of administering the medicine. Yeah, thank you.
Does this work, folks? Can you see the screen now? And is it visible? I know it's not in presentation mode, but somehow it won't let me flip the screens. So I'm going to go with it as is. Gabby, I appreciate you being here and able to punt for Chief Black. I don't think I have an email or anything, so I'm not sure where he is. But if I go through slides, will you be able to describe it?
Absolutely.
Okay, thank you.
Want me to start here?
Yes, that would be great.
Okay, so the Fire CARES program is something I've been actually doing in Paulsbo for a little over a year now. It stands for Community Assistance Referral and Education Services. It essentially partners us with a firefighter, EMT, and a mental health professional, and then a substance use disorder professional. So for several months, from November until April. I was the primary community support specialist over there. And then we finally got our MHP, who's pretty awesome now. I've been working with Chief Black to get this program going here in Jefferson County for quite a while, and we're finally doing it. So we're really excited. You can go to the next slide. So what is CARES? CARES is a proactive program. It's fire-based. It's essentially having a navigator with the fire department. There's a lot of behavioral health and medical and lifestyle issues that don't end up with a law enforcement referral. So those navigators will never see these people. There are cases where we do intersect with law enforcement navigators, and we work closely with them in Paulsbo, and I hope to do that in Jefferson County as well. Some of the calls that we respond to or follow up with, most of the program is a follow-up program, and we follow up with people after they've had an incident that can be behavioral health related, anxiety attacks, panic attacks, overdose, alcohol intoxication, other intoxication. We also respond to active crisis calls, CPR in progress, DOA calls. We do respond to those, and we console the family while the crews work on their person. We're not there to provide on-scene medical care for people. We leave that up to whoever's there to provide those services. We just console the family. Some of these things that we also provide is the high utilizers of 911 for non-emergent needs. We do follow up with them and try to intervene in their care where we can get them services like medical services in-house. Sometimes they need caregivers, sometimes they need medical equipment. A lot of people call 911s because they need a ride to or from their doctor's appointments. They can't get out of their house for whatever reason. So some of those are things that we will follow up on just to prevent unnecessary 911 calls and free up the crews so that they can do what they need to do to be life-saving out there. Thanks. So the goal of CARES is to connect and reinforce appropriate services and care while reducing the impact to emergency services. Members of our underserved community find it challenging to access variable resources, and the CARES program can help establish the first step and ensure individuals stay on the right path, because it is more of a follow-up program with people that, oh good, Chief Black's here. Because it is more of a follow-up program with people, we are able to connect them to appropriate resources, where a lot of calls, the crews get in and they get out so that they can be with people who need life-saving measures. And so we're able to spend actual time with people. And since Chief Black is here, he might want to take over, but.
Hi, Chief Black, good to see you. Gabby's introduced us to the program. I'm happy to go to the next slide. How would you like to handle it?
First of all, I apologize for being late. We have so many things going on right now with the merger and other last minute, things popping up. I got pulled into a meeting out of my control, so I apologize sincerely. This is a really important program for us and the community. And Gabby, you sound like you're doing a great job. So I'll let you continue, and then maybe if there's follow-up questions, I'd be happy to help answer those.
Thank you.
I would love to continue. So this is just kind of a heat map of all of the 911 calls for East Jefferson. This looks like it's from January of 2018 to December of last year. And you can see that most of the calls end up being in Port Townsend and Port Hadlock, Chimacum areas, but there are those other individuals in the outlying areas. We did work with Chief McKern and Chief Manley, so we're hoping to have some level of care out in South County with this program as well, because we're still in the planning phase. We're not sure what that looks like yet, but that's our plan. So the targeted impact, this is just a lovely pie chart that kind of breaks down the calls that we typically do respond to or follow up with. So mental health, behavioral health calls, we do follow up with people that have falls, lift assists, just because a lot of those people are elderly. Maybe they need some sort of medical equipment in their house to help them get up and out of bed properly. A lot of people, as they age in place, become weaker. And so getting them set up with services so that their significant other can be successful with them also, or if they live alone, they can continue to live alone. Some of the other calls that we respond to when people repeatedly call 911, the high utilizers, we do follow up with them just to kind of find out how we can actually best help them, because a lot of times it doesn't need to be a 911 call. So this also breaks it down. A lot of people call during business hours. You can see those numbers. I'm not going to go over every one of those, but a lot of people do call during business hours. And those, a lot of them are people that the CARES unit could be following up with or could be responding to.
Yeah, if I could just jump in on that last slide real quick, Gabby. An interesting anecdote is we are seeing a really statistically significant spike in East Jefferson and Port Ludlow with stacked calls. That means calls that are happening simultaneously or near simultaneously, to where we're at status zero. Basically, between both agencies, there's no more first responders available. And one of the things that this graph illustrates is sometimes a call will last longer than a 911 resource would be the appropriate tool. So we could maybe, if a 911 resource is dispatched for, a lift assist, with maybe some underlying other modality, once that unit has stabilized the incident, and if the patient decides they don't want to be transported, we could summons the care unit if they're available to come and hand the call off to help with some of the other lifestyle engineering facets of that patient contact, and then free up that 911 resource for the next call. And that's one of the things this chart kind of illustrates, is during daylight hours that could have a pretty good impact on that paradigm of step calls.
So Kim Hendrickson is who I work for the city of Paulsbo. She's the director of Housing, Health, and Human Services. She's also the chair of the Washington State Co-Responder Outreach Alliance. She's an amazing woman. Definitely helped us get the grant going for AWC. And she's been a major support of this program and is graciously allowing us to train our individuals over there in Paulsbo. So the Alternative Response Team grant is the grant that we did apply for through the city of Fort Townsend. And we were awarded that, as you already reported earlier. I believe the award was $217,000. That included startup costs for the program. It is an expensive program to run. And the vehicle, computer, everything that we needed was included in that grant. Those funds have to be utilized by June 30th of 2023. So those funds are only available for 6 months. I just answered this. So I'm not going to go over all of that, but it does. Okay. Yeah. The AWC grant did, like I said, fund all of the startup costs associated with this program. There are several other agencies already doing a CARES program. The city of Paulsbo also applied for this in order to expand into Central Kitsap. And so we did get that grant over there as well. So we are expanding over there too, which is really exciting. These are, if anybody wants to see other places that are doing a CARES program, my beautiful picture is on the City of Paulsbo's Fire CARES website if anyone wants to see what we do over there. And then the City of Tacoma and Puget Sound Fire are also on there. And it looks like out of everybody that applied for the AWC grant, I think we were one of 8 that were awarded in full. And then several others were, not sure how many were awarded partially. But all of those funds, again, have to be utilized by the end of June. So we'll still be working with people and referring them to the appropriate care when needed, whether that's DBH, the hospital, Jefferson Healthcare, other doctors' offices, whoever they're already working with. We try to establish that care for them and make sure that they can make their appointments. If they need appointments, we'll make those for them. We're definitely not trying to be anybody's care response long-term. So again, it's not a clinical role. We're just trying to get people where they need to be and make sure that they're able to be successful in making those appointments. So our co-responder, we will have a mental health professional that is the main co-responder, and we'll also have substance use disorder professional on the team as well, paired with a firefighter EMT. And again, we'll be training with Paulsbo Fire CARES beginning in January for a couple weeks. I've already started training my staff just because I've already been in this role for quite a while now. So they've been training. We are in the process of onboarding our mental health professional. And I know that we're doing interviews soon for the firefighter EMT position. The daily routine. So the daily routine, we always start with pulling what's called an ESO report. So we pull reports out of the ESO, we prioritize those referrals. Anybody who has any kind of suicidal ideation or suicide attempt, we try to meet with them within 24 hours. Everybody else gets like a 72-hour priority response. And if we can meet with them the next day, we definitely try to do that. We take referrals from the fire department, JEFCOM, law enforcement, and partner agencies. I think to start with, it'll mainly be fire and law that get people referred to us. Once we have the referrals that we need for the day, we come up with a schedule, we map it out, we check in with the battalion chief. In the case of Paulsbo, we check in with the captain, and we let them know where we're going to be going. We are always prepared to adapt the schedule as needed because we just never know what's going to be happening. And then at the end of the day, we come back, we document, we do all of the follow-up calls that we need to do. Typically in a day, we can, just depending on how long each person takes, we can make 5 to probably 15 contacts with people. It really just depends on the needs of each and every person that we're seeing. It also depends on what happens. So we could be out on a shift and then all of a sudden there's a CPR in progress and we have to go to that. So it really just depends on what our day looks like. There's no typical day in this job at all. And you never know what you're going to be seeing. You never know what you're going to be dealing with. So just being prepared to deal with the unexpected all the time is something that we've really had to do in Paulsbo, and I know we're going to have to do that here as well. I think the documentation and the follow-up is really key for this program because that's how we know that we're making a difference, but it also gets us going with making referrals and following up on those referrals after we've made them and continuing to follow up with the individuals and making sure that they're making their appointments.
Thank you, Gabby. I appreciate you pinch hitting. Very thorough. Chief Black, was there anything you wanted to add before we go over to the questions?
Yeah, I just, Gabby mentioned the recruitment for the firefighter side will be done by this time next week. So far, the application period closes Monday, and we have 4 applicants already. So I anticipate as people rotate through the shifts of the weekend, we might get a couple more, but it's open to any EMT or higher qualified member in both East Jefferson and Port Ludlow Fire, which is soon to be one happy family.
Great, thank you. Okay.
And I owe Gabby lunch for pinch hitting. Thank you, Gabby.
Okay, I'm going over to the questions that folks have been putting into the Padlet. On the, well, let's just start with the CARES program since we just went through that one. On the CARES program, let's see, the first question is, how will this program interplay with other outreach and street-oriented programs in the community, like real?
I know in Paulsbo, for the most part, we end up, if we need to refer to the real team for something over there, we do, because there is a real team over there. It really depends on the person that we're dealing with at that moment and what their needs are. So if there needs to be, I mean, this isn't like a street outreach or street oriented program. We're not going out tromping through the woods, talking to people out there. That's not what we're doing. We're following up on active 911 calls. So if somebody's intoxicated in the woods and their friend calls us, we're not going to go out there. We would refer them to the real team or to the street outreach team, or whoever we need to refer them to. It's only active 911 calls that will get a response from us. But again, if they're already engaged with people in the community like DBH or Believe in Recovery, or if they're dealing with a real team or any other program, we're going to push them back to their providers. This is not a clinical role. We're not providing clinical based services. So we are trying to get them connected with the people that are already working with them. Or if they don't have somebody working with them, we're trying to get them set up with those services.
Just to add on to that, I think one of the goals is to make sure that we overlap with our partners, such as the navigators, the real team, in Jefferson Health Cares program, et cetera. So the familiarity and awareness of what the subtle but important different programs are is going to be kind of the first step when we initiate the program in January. So there'll be kind of an orientation, if you will, between the real team, the navigators, the hospital, other service providers in the county, to make sure that we have that relationship and connection that, hey, this would be better handled by a navigator, this issue would be handled by the real team, or maybe part would be handled by the CARES unit, and then they know what chunks can be kind of sectioned up. So that's the same process they went through in Paulsbo, is kind of building those relationships between the different agencies.
Thank you. The next question is on everybody's mind about everything. What's the long-term outlook for the funding after August?
So we did get that $50,000 from the 0.1% for this next year. And we're also awarded for another $50,000 in 2024. Because co-responders is becoming more mainstream, there are a ton of grant opportunities. So Chief Black and I will continue to apply for as many grants as we can.
Thank you. I apologize. Somebody had their hand up and then I don't know where they went. If there was somebody who had a question.
I'll just add on to that last question, Lori, if that's okay, or last
Sure.
answer.
Yeah.
The sustainability of the project, financial sustainability, I think is, one of the things that myself and the fire commissioners are all very concerned about, and they're very enthusiastic about this program. And in talking, the more research I present to them and the more connections they're making outside of my information flow to their counterparts, they're hearing a lot of support in the community and our other local government partners for this program. So the sustainability question and how East Jefferson decides to fund this as well is high on the radar for our commissioners as a funding priority long term. They're very enthusiastic. We have most of our commissioners come from the EMS or fire world and are pretty excited about this program.
Thank you. There's a question around referrals. Does this program take referrals from social service and health agencies? And how will you refer back to the hospital or other agencies?
So this is mainly, like I said, a response to an incident that resulted in a 911 call. Currently, we don't take referrals. Most agencies, the hospital included, have some level of navigator embedded in them now. It's more and more popular and prevalent that agencies do have some level of navigator that can take care of their referrals from them. So we do not at this point, at least in Paulsbo, and we're still in the planning phase here. So it probably would be a while before we started taking referrals from just any source. This is a program to intervene in high utilization of 911 and provide services for those people. So no, not currently. And what was the other question? How do we refer back to them? We have them sign a release of information when we are there if they want us to collaborate with their healthcare provider. So the individual sign a release, we'll send the release to their medical provider, and then we follow up. So whether that's showing up at the doctor's office and saying, hey, we have this person that keeps falling, or we have this person that needs these services, or this person hasn't been to the doctor in 3 months. Can we make them an appointment? What do we need to do? But we have people sign a release when we get there so that we are able to collaborate with their providers.
Thank you.
Yeah, just to add on to that, the focus, or one of the focuses, is to be kind of the frontline initial response to the 911 element, whether there's a law element or not, and that'll kind of, if it's law centric, it'll be pivoted to the navigator with probably some element from the Fire CARES program. But if there is no law element, to what Gabby said, we're trying to break the cycle as early as possible and direct the individual to the right care as soon as possible. In one example, when I did my ride along with Gabby and firefighter Dave over in Paulsbo, one of our incidents we followed up on was a gentleman that's a widower and suffering from depression. And we checked in on him because he was also falling quite often out in front of his home on some steep steps. And so he would have a little bit of alcohol issue when he'd get really depressed and fall down his steps. And we were able to intervene and facilitate a ramp being built in front of his mobile home so he wouldn't fall, and then try to make sure he was getting connected with some social services for the depression and some counseling for the alcohol abuse. And since that time, when I went, one of the questions I had is, have we seen a reduction in his repeat 911 calls, which I guess was frequent, a couple times a month at least. And he hadn't called 911 in months since we initiated that. And that's kind of the focus, and the modalities are sometimes overlapping, a lot of times overlapping. And I think that's a really good example of how the CARES unit right now, we have a patient like that here in Ludlow that we've gone to several times with very similar circumstances. And those instances exist throughout the county.
Thank you. Dr. Carlbaum, I see your hand is raised.
Yeah, thanks. This is the first time, well, I mean, this week is the first time I've heard about this grant that it sounds like you got back in September. So congratulations. I think it's an exciting program. I guess I'm a little confused in that I'm hearing it's focused on substance use, but when you showed the pie chart with numbers, not percentages of the PALSBO, substance use was the smallest stripe of that. And it was sort of focused on other things, falls, et cetera. I guess, what was the needs assessment done in our community? Because I think while easy just to copy and paste PALSBO's program straight across as a beginning point, I guess I feel like this new program is really duplicating a lot of services we have. So was there a needs assessment? Have you already collaborated with Jim at Discovery Behavioral Health? Have you collaborated with the hospital and with public health around finding where that niche should fit? Because I feel like we have a lot of services in place for the activities you're already describing.
Yeah, Doctor, the pie chart you're referring to is not Paulsbo's, that's ours. And as you know, those are only categories out of ESO where they can only choose one primary, criteria for the call type, if you will. So frequently there's underlying, factors where, you're canceled at scene or non-transport and so on. So that was used to just give us an overall raw number, not just for substance abuse. That's one part of it. And that's a similar process that PALSBO went through as well, which is the program you had forwarded to me approximately a year ago. So
yeah, I did forward it to you among many others that are in Spokane and in Tacoma.
Yeah.
So I have a separate question. It seems like the one advantage of the CARES program is it has a medical person, right? So the real team doesn't have a state of Washington certified medical provider, whereas the CARES program will. So how it seems like a unique opportunity to begin doing Suboxone microinjections. And so is that part of the plan?
No, we'll be doing distribution of naloxone and doing
Suboxone, which is a treatment for opioid addiction. The city of Tacoma does it, where they have personnel that respond to an overdose as co-responders, and then when that person's very interested in quitting at that moment, often that moment is hours long, maybe 24 hours, they can start them on medication to reduce their cravings. Just seems like a great opportunity.
So we personally do not get people inducted. I mean, you need a very specific license to induct people on Suboxone, but we are partnered. We at Believe in Recovery are partnered with OPHS. And as long as we do the things that they need in order to induct somebody on Suboxone, which is like a whole little series of things to induct somebody, or we can take them to their office and do the things, we can do that.
Why not just take them to Discovery Behavioral Health that does it? Why go out of the community?
OPHS is in our community. They work.
Oh, sorry, I thought they were Clallam County. My apologies.
No, they have an office in Port Haddock, and they also rent space in our office one day a week. Discovery Behavioral Health closes at a certain time. OPHS will do telehealth appointments when we need them. So if that's at 9 p.m., we just call them and they'll do it. The real team does not go out into people's homes that have, I mean, if you have a 86-year-old woman who keeps falling because maybe she had a glass of wine and she falls down, the real team's not going to get called to that event. So if she calls 911, it's going to be a 911 response. It's not going to be the real team responding. So this is a different program than the real team. If somebody's already engaged with the real team and then they have a 911 response, we refer them back to the real team or to DBH or to Jefferson Healthcare. We have them sign those releases when they get to us, and we make sure that we collaborate with who they're already getting services from.
Gabby, Commissioner Brotherton?
Yeah, thanks. I think it sounds really exciting, with, and I'm learning something even from the real subject matter expert questions too. But I was just wondering if you can kind of break down a little bit more the co-responder thing. I'm not sure I understand this. I mean, is will the CARES team be a user agency at JeffCom, or are they going to get contacted by the user agencies and be secondary responders? Or is it, do you understand my question?
It's a secondary response.
Okay.
I think in the 13 months that I've been in Paulsbo, there's been one incident where we've been the first people on scene, and that just happened to be because a 911 call came out with somebody that we were already engaged with, and we were literally already on the way to their house. So we just happened to be the first people there. We are not showing up to car accidents. We're not showing up to things like that. We're not showing up to do CPR on somebody. We're showing up to like console the family while the crews work on the person, and so that they can do their job.
It sounds exciting. It sounds like case management for, non-behavioral health, like, I don't know, what did you call it? Lifestyle and age issues as well. I mean, it sounds very interesting.
We do a bit of everything, and I will offer you the same thing I've offered everyone else. If you want to do a ride along, I am happy to escort you and show you exactly what it is that we do. Your day will be different than when Chief Black rode with me. It'll be different when everybody else rides with me too. Every day is different.
Sign me up. I'm there.
I will sign you up.
Okay, I want to get to a couple of other questions that were on the Padlet. One of them is around falls. How are PCPs alerted that their patients are falling? Is there a link back to the healthcare system?
So we do have them sign a release of information, and we do contact their providers through the CARES unit. There should be some level of thing that the hospital can do to look at their person through Epic.
This was obviously my question, and I think that it had been asked and answered earlier. I guess, Gabby, I know that you were just responding on the fly and saying, we'll just show up to the doctor's office and say, how do we get this person an appointment? We probably need to build those relationships and that process beforehand, because we have a ton of PCPs. And please don't forget about us whenever you're talking about Suboxone induction too. We do a ton of Suboxone for our patients as well. So this is the first deep dive I've gotten into this, and it's really exciting. But if the hospital is going to be a support or a stakeholder in any way, then I think that we should start talking sooner, since it's already halfway through December almost.
Thank you. Another question was around the cost for a navigator. The cost for the navigator, I think there was a sense maybe that 300,000 was a lot. So maybe there's some breakdown there. And then also, what is the annual cost of the program once it's set up? Knowing that we've got 50,000 coming in for each of the following upcoming years, but there will be a gap.
So the cost of the actual navigator, or cost of because you're funding a firefighter, EMT, their salary and benefits, you're funding a social worker or mental health professional, and you're also funding a substance use disorder provider. So you're funding 3 positions. The SCDP will be part-time. So you're funding those 2 positions, but then you've got transportation. So you've got the vehicle and the maintenance and everything that goes with that. I can break down an entire budget for you when I'm not in South Carolina on my phone.
Thank you.
I don't know what Chief Black has in front of him. Off the top of my head, I want to say it's about $275,000 a year for the entire program. And that's 40 hours a week of programming.
Yeah, the 275 is what stuck in my head, Gabby, because we had 2 grants we were applying for together. So the AWC grant was including all the startup costs, the training and all of that. This is the sustaining, bucket of, if you will, and that 50 grand is going to go into that bucket to help sustain it beyond the AWC performance period. And that's where, as I mentioned earlier, our commissioners are pretty enthusiastic about the program, and they haven't outright committed to support, much more than what they've already committed to it. But that's, to Gabby's point, we're going to be looking for other grant opportunities as well.
Thank you. Then there was a question around mental health professional oversight that the care navigator would receive. And I might only have 5 more minutes.
So supervision will be provided for the mental health professional. we are in the process of contracting with that provider as well to provide supervision for the program.
Okay. And then is the plan to hire more firefighters for the program?
For now, we're just funding one person for 40 hours a week, but Gabby in North Kitsap County and Central Kitsap County, that, as you saw on the list of agencies that got grant funding, that program is growing significantly over there. And I could see in the future that potential here to go beyond 40 hours a week. So yeah, for now we're crawl, walk, running, if you will, using that metaphor. And, everything from the relationships with our law partners and the hospital and the real team and navigators is really going to be the focus for the first, first portion of this program. And then, trying to, learn from Paulsbo's great experience as well.
Thank you. And then how will CARES chart in Epic so the health team can see is the question?
So we don't chart in Epic. We have our own EHR. So we would, again, just make that referral. So if somebody gives us an ROI for Dr. Erickson, we would send Dr. Erickson an encrypted email or fax, or once we get the program going and we start making these connections with the community partners that will be working with on a regular basis, like Dr. Erickson or any other doctor up there. He's the only one that I know in my head right now. But whoever we're making connections with, we'll start doing that once we get the program going, once we have our team established, and we'll start making those connections and find out how people and how certain individual providers want us to relay that we've been working with their person. So it really just depends on everyone. I know DBH has their own EHR too, so it's not like we're going to get their EHR system. It'll be the same once we establish relationships with all of these partners. We'll be making those connections and figuring out how they want us to refer to them.
Thank you. Dr. Carlbaum?
Yeah, I guess I'm slightly confused. As the supervising physician who all pre-hospital medical care is provided under my license, I would assume that since it's a firefighter EMT or a paramedic, firefighter paramedic, that there should be charting and vital signs obtained per our policies and protocols.
So that's done on the fire side. On the behavioral health side, the social worker, mental health professional, SUDP we use a different software.
Who do they work for though? Who's their responsible physician?
Who's the social worker, mental health professional's physician? They work for me.
Okay. Okay, we'll need to chat offline more. I'm a little confused. It seems like a risk to have no charting when the team is in the house and some catastrophe happens within 24 hours or something. So
there is charting. We can definitely talk more offline.
I want to skip to there's the question of why does this require the hiring of a firefighter EMT? That's one question. And then I know we've only got a minute left. So is everybody good with staying on for a couple of minutes, or should we table this discussion and come back to it at the next meeting? We can also have a discussion where it's just the folks who are on the MOU who are going to be voting on this outside of Brett, Chief Black, who I know would need to recuse himself from the actual vote of the money. How would we like to handle this going forward? We can talk about it more at the next meeting. 5 more minutes. 5 more minutes. Hands up. Okay. All right. So let's hit then. Why does this require hiring a firefighter EMT?
Yes. Well, as some of you were involved in our strategic plan and standards to cover, you're probably very aware that we are resource deficient in our county with firefighters. We can't even put an effective response force together that meets the national standard of 16 firefighters for a structure fire. We only have about 13 on duty at minimum staffing between Port Ludlow and East Jefferson. So we don't have extra firefighters just in a vault somewhere. So we would reassign a firefighter that we already have that has the wisdom and experience in our community and with some relationship with all of you and our protocols, most importantly. And then we would backfill, or we are going to be backfilling that vacancy with a new recruit firefighter that'll fill that spot where that firefighter came from.
Thank you.
Mhm.
Okay, over to other questions. The city, maybe somebody can say, has anyone from the city been part of the BHC? Should a city representative be here? Maybe because the city has already funded a piece of this. Is this what we're talking about? So, and we also had funding from the BHAC that has gone toward this. Has there been conversation among these different funding bodies outside of BHC where there's been some collaboration and understanding of how we're braiding the funding and what we're braiding it toward? I'm asking those who serve on both, for instance, the BHAC and the BHC, Apple. Who else is on the BHC? It's just Apple who would know.
That's me.
Yeah.
I'm afraid I'm not totally sure what the braiding discussion has been like. I apologize. I don't believe I have an answer to that at this point.
Okay.
Yeah, the program was initially, the AWC, the Association of Washington Cities, is the grantee, and the host agency is the city of Port Townsend, and we've been collaborating with Chief Olson, who's on the meeting today, and the city manager, and that's really where this project started about 3 months ago, to just see if they were interested in partnering on this, because they were the only way to get that startup money for this program. And then we, kind of built the program using Paulsbo's model, and at the same time found out about the 1/10 of 1% opportunity. We weren't aware of the BHC as being, accessible for any of the funds until I think less than 2 weeks ago. So there really wasn't, that wasn't part of the initial thought, but it's appreciated, and I think that'll definitely sustain the program if it's approved.
Well, so I want to make everybody aware, if you're unaware and assigned member of the MOU, we have a grant and we have funding that is for those activities that we keep throwing up under prevention, treatment, and recovery. And so we would of course like to hear about whatever things are being explored and masterminded and planned, so that we could have a chance to make sure that the point of this table is to have everybody at the table telling each other what it is that we're doing and how it is that we need funding, because I think that we can do a lot more as a team than we can separately. So maybe that question there just has to do with, we need to get somebody from the city, and if it's John Morrow, more aware of the BHC and how it could be helpful in this process. That said, I'm very happy if there is funding that we can give that can keep this program going as we reach to get more funding in on the CARES front. Dr. Carlbaum?
Yeah, I guess I can't help but continue to think of an African proverb that some of the people I do sepsis work with in Africa say, which is, if you want to go fast, go alone. If you want to go far, go together. And I have to admit, I'm surprised so much work has been done without involving this group, because I think there's a lot of opportunity for collaboration to make it stronger. I'm glad those efforts are beginning. I hope they continue. I guess I feel like needs to be a lot of planning before this program can start, and I'm not sure that planning can happen over the holidays, but I'm glad we're starting. So thanks for starting.
Thank you. Somebody else made the comment that it seems like a number of the falls in that pie chart, because it's so large, that we should be reaching out to O3A to see if there's any possible funding there for the falls portion of this. So that's something I can look into and see if I can make some connections for folks. Are there any, I feel like we should stop and take the temperature of the room before we walk out, because it's been a great discussion. I really appreciate Chief Black and Gabby coming forward and having this conversation. Dr. Carlbaum?
I hate putting people on the spot and cold calling. I'm told not to do it as a teacher, but gosh, I would love to hear Jim Novelli's thoughts on this new and exciting program, if he's able to do that.
Well, I think it's a good program. My question is how it's gonna, my concern is when you have somebody out there and they have to call for somebody for help, how are they gonna discern all these different groups that are starting to form? It would seem like we're getting much more fragmentation going on again. When we thought about bringing things together, and we see like we have these different programs and, you know, we're talking South County. Is this program gonna work up in Port Townsend also, CARES? Is it the whole county? You know, I think there's just a lot of questions I have on how it's going to interact. This is the first I've heard about this. Nobody's talked to me about the CARES program or how our agency can be of help or assistance and how we would interact, because we have mobile crisis outreach, you know, and our mobile crisis outreach is when people do have mental health issues and have to discern whether that person needs to get to a hospital for a mental health issue or even for substance use disorder too. So, I mean, you know, the question is every second that's wasted or time that's spent with different teams trying to navigate around what's going on, it concerns me. It slows down that process of quick response. You know, is this a 24-hour program? Or is this only, you know, during business hours? So I have a lot of questions. I mean, I have nothing against forming a program like this, but I think a partnership ahead of time would have been a little more helpful, really understanding. I hear what Donya's saying, and you know, I think we'll just know more about how this is going to interact, because we have, you know, we have quite a few. We have a navigator that's, you know, I know they put the BHC put money out for a navigator again in Port Townsend. What's going to be the navigator for the Port Townsend police? How's that going to interact with this? You know, we have our sheriff's navigator with Jefferson County. So, and, you know, Real Team starting in January is supposed to go 24/7. So we have to expand our hours to a 24/7 program. So we're going to have people available. So I'm just trying to piece all this together in my head. It's a big chessboard right now to me. So,
yeah, if I could respond real quick, Lori, and maybe this is more a response not just to Jim, but a lot of people that have asked some really good questions. It wasn't clear to me exactly how useful this program could be until I did a ride along. And really, you know, over my careers as a first responder, you know, a large majority of my calls that I remember are low acuity to medium acuity that have non-911 elements to them. That is, you're using a, you know, a 60,000 pound fire truck that costs, you know, almost $1 million now in an ambulance to respond to somebody that really doesn't need that level of resource. And so we're the model that is, you know, been instituted in the fire service over the past, you know, several years is this Fire CARES is very similar to how law enforcement's pivoted and altered their response model with the navigators. We're trying to use the right tool in the toolbox for the needs of the community and keep the higher trained and excuse me, higher equipped firefighters and paramedics pristine for the real main function that they're really good at. But that's the underlying need that we have in our organization, is to try to bring down some of the low acuity, you know, repeat callers and get them the right care. That's really the fundamental result, is get them the right care as soon as possible. And you know, I think we covered the highlights that I just heard asked with. It's a 40-hour unit. It will fold in nicely with the law enforcement navigators, with the sheriff's office and the city. It is an East Jefferson County, not East Jefferson Fire, but East Jefferson County asset. So it will be, you know, rubbing around as needed throughout Eastern Jefferson County. But do a ride along. It is illuminating. It's really a good opportunity.
Jim, I would love for you to come ride along with us. It's a good program. And again, we're not trying to take over anything with the Real Team or anything. This is solely activated by 911 calls, not just showing up to people. People have to activate 911 to get a response from the CARES unit.
Well,
email me.
I'm not fearful of anybody taking over. It's just, it's a question of collaboration and making sure we have all these different entities kind of working together. And, you know, I'm familiar with this when I worked with DSHS over in Clallam County. I had Dan Montana, who started something similar to this and goes out to people. And I worked for APS, and I understand some of this population is more of an APS kind of population than a mental health or behavioral health. So my question becomes, my question is, what's the role of an MHP or an SUDP if you're really looking at more lifestyle type of stuff? So which, you know, seems to cross over into the paths of, you know, the mobile crisis response team and things like that. So that's all, just how we integrate that better.
I want to thank everybody for staying on these extra minutes today. I think I'm going to send an email out to the signatories of the MOU who would be voting on this and ask them if they'd like to have further discussion about it before we take a vote, or we will take a vote, but I will send an email out to everybody letting you know what the result of that is so that you know whether we're going forward or we'll discuss this more at an upcoming meeting. Thank you so much. Have a great afternoon.
Hey, Lori, could I just have a closing statement just for like 10 seconds?
Sure.
I just want to say thank you to everybody for taking the time to really come up with some constructive questions. And if I had to go back in time and restructure how we messaged this program and built it, I would first of all slow down the time machine and give us a lot more time to try to reach out and connect with Jim and the hospital and public health to make sure we were including everybody. But this opportunity came up on very short notice. Myself and the city manager and Tom Olson, the police chief, we worked all weekend to put this grant application together on a very short timeline. And so it wasn't ideal the way that it happened, but these grant opportunities, sometimes that's how they happen, is we find out about them with little or no lead time. And we knew that there was a great partner right across the bridge that we could copy paste a lot of their procedures and their wisdom into this program that I think is going to have a similar result to what they've experienced over there. So again, my apologies if some members of the BHC feel disconnected from this. I wish I could have included everybody right away, but we had to kind of just focus on the opportunity in front of us.
Thank you, Chief Black. Okay.
Thank you.
Thank you, everybody, for playing today.